more and more about what's really some of the core issues going on here with these women, and really didn't find that doing a hysterectomy was necessarily a satisfactory route to go. These ladies had issues that the bleeding was a symptom of, and treating the symptoms certainly did not treat the underlying physiology. And I think one of the compelling things that I want you to take home today from the ALCAT, from this ALCAT review, is that this is a physiologically meaningful, practical test that can have some profound life-changing effects if you pick it for the right people. Frankly, it can help everyone, but I tend to often stress this test in my most complicated patients. So we want to discuss how, specifically how I use the ALCAT test in my practice. My main goal with this is to address your clinical questions. So as we go through this, please get them in there. I'd like to save at least 20 minutes at the end for your questions, and I'll be watching the time pretty closely. And I want this to be highly valuable to you. So we're going to look at food allergy versus sensitivity, inflammation as the key to disease here, gut health as a central factor in wellness, a little bit about IgG testing, but we're really here to talk about ALCAT and not compare it to IgG. It's sort of like comparing apples to oranges in many ways anyway. I'll talk a little bit about the different test panels and tell you why I do what I do. And I'm going to go through a clinical case. All right. Oh, there we go. Sorry. Let me go back. Okay. You have a couple different arms of the immune system. One is called Th1. That's a cell-mediated arm. That arm of the immune system tends to fight bad infections, bacteria, viruses, etc. Then you have the other arm of the immune system, which is called the Th2 arm, or the humoral arm. That's the antibody-generating arm. And the way I tend to think about it is this is the antibody-generating arm of the immune system. And when most people come into the office and say, oh, I already had that allergy testing done, they're typically talking about a skin test, a RAS test, or they're talking about IgG testing in the serum. And the ALCAT test is really a paradigm shift. It's looking at cell-based immunity and inflammatory issues. This test is, because it is looking at inflammation in the immune system, as we know, the immune system is active throughout the entire body, and that's why people with autoimmune diseases and inflammatory conditions tend to have a wide array of conditions. You look at this list here, and you think about your typical fibromyalgia patient or chronic fatigue patients. These people have a wide variety of symptoms. Mood disorders. I'm beginning to think about many mental illnesses or mood disorders as an inflammation of the brain, ADHD, autism, inflammation of the brain in many ways. So when I think of ALCAT testing, I think of immune system, I think of inflammation, and these are many of the conditions that this can be useful for. The gut is, everybody has gut problems, and it's probably because of the food we eat and the fact that we think that going to McDonald's is somehow maybe normal, and the synthetics in the food that we eat is normal. And honestly, as I've dug deeper and deeper into this and have been really living the lifestyle of wellness myself for about 3 years, I realized that so much of what I thought I knew was wrong, and so much of what I thought was food is not food. We don't eat food anymore, in my opinion. We eat sort of food-like substances, and stand in the grocery store and watch the food people go away with in their carts. It's not real food. It didn't come out of the ground. It didn't come off of a tree. And the one thing about our body is we control what we put in our body, because we control what we put in our mouth. And the gut is sort of that final barrier between what we've chosen to put in our mouth and what gets into our body. So it really is exposed to probably thousands of toxins and it's a barrier between us and the outside world. If I can only treat one particular system in any patient, especially my most complicated patients, hormones versus heavy metals versus nutrients, I'm going to go for the gut, because the gut is really where it's at in wellness. The ALCAT test, again, is looking at sort of a central inflammatory process of the body. IgG doesn't necessarily correlate with inflammation or symptoms or disease. The way that I view the ALCAT test is the results really show you what is inflaming the immune system. What foods are you putting in your body that are inflaming the immune system? And really that immunity is the final common pathway of inflammation, and inflammation is disease. The ALCAT test uses whole blood, exposes the white blood cells to food antigens, and basically measures the inflammatory response by virtue of the size of the cell. So as a white blood cell reacts, it inflames, and the more intense the reaction, the more it degranulates. And you see this little slide here of the neutrophil degranulating, and a neutrophil that has completely degranulated shrinks in size, and that's really the most severe reaction that we can see. If you haven't done an ALCAT test yet, this is what the results are going to come and look like for you. You know, I think of green as go, yellow is mild, orange moderate, red severe. Then you got the blues down here, and they're looking at reaction to Candida albicans, glutens and gliadin, and whey and casein, so your milks. Within each ALCAT packet that your patients receive or that you receive, there's a nice booklet that goes through a variety of issues to help clarify the test results, discussing rotational diets, nutritional information, and some information on some of the other types of tests that people aren't commonly familiar with, like the chemicals and the molds and the additives and the colorings. I find a variety of clinicians using these tests, and you know, I know we have a variety of different types of practitioners on here. If you deal with human beings, you can do an ALCAT test, and that ALCAT testing will bring value to your patients. So my objectives with this talk are to teach you how ALCAT makes a difference, get a good sense of inflammation is disease, how to select patients, and go through some clinical questions. As I said, I used to be an OBGYN. I've transitioned my life into consultative functional medicine, so I work with patients face-to-face, coaching them, counseling them, dealing with hormone therapy, nutritional issues. I'm oftentimes that final doc of, you know, the patient who says, well, I've been to 20 physicians and nobody's been able to figure out what's going on, and maybe you can help me. Okay, I got that. I saw that question. And I have several practice locations across the state of Michigan, and I'm also working on creating a wellness center down in Louisiana where I used to be at. So I think the best way that I can illustrate what ALCAT means to me is in this case, and this is the first patient that I used the ALCAT test in, and it illustrates the complicated nature of some of these patients that we deal with, and sort of the immune nature of inflammation and gut health and such. So this is a gal named Libby. When I initially saw her, she was 32 years old, had 4 children, and was married. Her primary issue was pelvic pain, nighttime voiding, and arthritis. And she really described her quality of life as horrible. She had been having kind of a peculiar 5-year worsening of these symptoms. And actually, when you really get into her story, it's been going on a long time in her life. She had had an appendectomy because of this funny abdominal pain she was having. It would come and go. There was nothing occurring with any regularity. She had some overlying asthma, atopic dermatitis. Her pregnancies were complicated by preterm labor symptoms, some early dilation, but she had term births, some abnormal glucose tolerance testing, which kind of makes me think endocrine, what's going on with endocrine. And she had had 2 of her 4 pregnancies. She was admitted to the intensive care unit for hives, and during her 3rd pregnancy, she had had these migrating roving hives and had to be on high-dose steroids. And nobody really had any answers. They thought maybe it was a prenatal vitamin that she was on or something. Just of note, if you take care of pregnant women or are a woman and have pregnancy, or you're a husband that has a wife pregnant, or you deal with anybody in this reproductive age, I think of preterm labor as really an inflammatory process. And when you look at these women and they've done cervical analyses, there is definitely more inflammation or more prostaglandins, inflammatory mediators in the cervical mucus of these patients. And I think of this patient, Libby, here, and the nature, the immune and inflammatory nature of her problems that we've ultimately discovered. And I kind of wonder if that wasn't some of those early tells. Many times in these complicated patients, you find that, it's retrospective. You look back and you go, oh, I bet that was a sign of things starting to go awry. And in my clinical practice now, I like to pick up on these things. Like I have a patient now who is about 44 on birth control pills, and she's having these hiving outbreaks. She's got some abnormal cortisol testing, but just some subtle stuff, subtly low thyroid, family history of autoimmune disease and thyroid. And, it's hard to know what to do with these people because she's basically kind of healthy and feels pretty good. So I'll probably, titrate her on a little bit of Cortef, get her gut cleaned up with ALCAT, and look at some stool testing. Libby, unfortunately, did not have a doctor thinking in these terms. They weren't thinking proactively. They weren't looking at her from a metabolic and physiologic standpoint. And that's what I would encourage you to do. Get these patients early before the disease is taken hold. By the time the disease is taken hold, anybody can figure it out. We're smart, we're thinkers, and we're going to come up with things before the disease process is taken hold. But when you get into these complicated patients, they often have underlying, family histories. This patient's mother had multiple sclerosis and also Hashimoto's, which I didn't put in here. Her father, it looks like her father's side of the family has a multiple endocrine neoplasia syndrome. So you're thinking, what's going on with the genetics of this family? Ultimately, I diagnosed Libby with interstitial cystitis, which is pelvic pain of bladder origin, or bladder pain syndrome. The name is kind of evolving. And at the time that I started working with her, I really wasn't doing much functional medicine at all. Did not know about ALCAT testing, and I placed her on the typical, gynecologic concoction for interstitial cystitis, which is Almiron, Elavil, and Vistaril. I was progressing in my training, and so I identified that she had some adrenal insufficiency with fairly flat cortisol pattern. If you do cortisol testing, we look at salivary cortisol levels in the morning, noon, afternoon, and late at night, and that gives us a sense of how their diurnal rhythm is with cortisol secretion as well as DHEA production. And those hormones are very reliably measured in the saliva. So that test showed her to have adrenal insufficiency, or other people call it adrenal fatigue, and her thyroid was marginal, TSH of around 3, and free thyroid hormones were low, free T4, free T3, and actually her thyroid antibodies were elevated, so she probably had Hashimoto's, at least at this time. I placed her on a good pharmaceutical-grade nutrient regimen and some adaptogenic herbs, Armour thyroid at 45 milligrams, and she got a little bit better. After several months, she noted about 30 to 40% improvement in all of her measures, but she still was using about 60 to 90 Vicodin a month for her pain. This is a lady that had 4 young children. She continued to try to find other alternative ways to help with her pain, and ultimately saw a physiatrist who was doing some manual medicine on her as well as acupuncture, and had tried her on a variety of meds, including Lyrica, Neurontin, Cymbalta, Celexa, kind of that whole, oh, you have chronic pain, let's throw some neuroleptics at you and see if we can help you. If you use these drugs or have patients using these drugs, these are some toxic substances, and this patient did not do well on these, and the meds weren't bringing a lot to her quality of life. Her weight was increasing, and all she really said is, look, I want to sleep and I want my pain improved. And so what do you do with someone like this? We were treating her interstitial cystitis with kind of the standard of care concoction. Her hormones were pretty balanced. I didn't do any hormone testing on her, but she had regular predictable menstrual cycles, normal amount of PMS. She did have worsening bladder symptoms when she had her menstrual period, which I've found I've been able to help with supplemental progesterone at this point, but wasn't really all that sophisticated with bioidentical hormone therapy at the time. She had an excellent customized nutrient regimen, and we had gotten her thyroid optimized and TSH down into the 1 to 1.5 range, although she persisted with thyroid antibodies. So what's next? Well, I guess the answer is down here. Go after the gut. And what I've learned now is, I used to kind of go after the gut later, and I go after the gut early now. But this was early on in my learning phase, and so one of my colleagues told me about the ALCAT test, and I was thinking about introducing it. So I thought this patient would be a good person to introduce it with. And so this was a look at her food sensitivity panel. Now, she had herbs and molds and food additives and such done as well. But and again, I don't know what you're thinking if you're looking at this going, this is the first one I've ever seen. Oh, that's interesting. Or, oh my gosh, this looks horrible. I've probably dealt with at least 100 people in their ALCAT tests by now. This continues to be the worst or one of the worst ALCAT tests I've ever seen, except for the fact that I'm surprised she doesn't have a gluten intolerance here and no problems with milks. But her entire mild column is full, and you can see the moderate and severe. So, here's the challenge. When you recommend a test like this for someone, you really potentially open a significant can of worms for them. How does someone, and I'm sorry, I don't think you can read the details of these foods, but how does someone practically deal with this many food sensitivities? Well, it's challenging, and they need to take an incremental, phased, patient approach to developing expertise in managing these food sensitivities. But the corollary to that question is, how can you not deal with it? If you have this many foods that are inflaming your immune system, what are you set up for in your life? So Libby was fairly aggressive, and she had been making changes in her diet. There was a book called The Maker's Diet that she got a hold of and brought into her family. That seemed to improve her health quite a bit. And then the ALCAT test showed her what specific foods she needed to avoid. So she took to this and worked hard at it. And as I said, what's your alternative? Well, the alternative is continue with your inflammation. She had a almost a miraculous, I hate to use that term, but it was an astounding turnaround when she implemented this diet. And this was a gal, and I'll just tell you, this is my wife. And one of the reasons we left Michigan and moved to Louisiana was because when November came and the temperature dipped below 50, the girl couldn't walk. and her arthritis flared up. She was having these peculiar symptoms, and we thought it was, you know, the cold. I don't know. We were clueless. I was in residency, and so uh, as we lived in Louisiana and she had another baby, pregnancy changes every aspect of a woman's hormones and immune system. She just kept getting worse and worse. And so, you know, I didn't really paint a very full picture of what life is like dealing with someone um, who you love and, you know, cherish with chronic pain, chronic fatigue, chronic inflammation, and she had had so many diagnoses that just weren't accurate, and nobody was able to bring anything to the table. So we saw this tremendous turnaround, and you know, we went to Las Vegas for a conference a few weeks after she implemented this diet, and that winter in Vegas, it was 30 degrees, and we were walking the main street in Vegas outside. She had no pain, no arthritis, and it was amazing. And honestly, I thought, wow, you know, I've got my wife back. This is fantastic. And as many of you have probably found with complicated patients with autoimmune type issues, you know, many times you end up going down a path, and she subsequently developed thyroid storm and Graves' disease, which was a huge setback. You know, I had really thought I had my wife back. But we persisted, and that was about a year ago that she got that diagnosis of Graves. She's developed multiple chemical sensitivities throughout this time, and we've tried a variety of modalities to help her, and she's actually doing well, but it's constantly a challenge. And I guess one of the reasons that I'm on this webinar to talk to you tonight is because ALCAT was a paradigm change for us in helping her get well, and continues to be key in reducing the inflammation in her body. But, you know, it's not the end-all be-all. You need to be thinking about customized nutrients in these people, supporting their phase 1 and phase 2 detoxification systems, balancing their hormones. Remember that the cellular and the humoral arms of the immune system are influenced by your hormones. And it's an intimate balancing act, and you know, you have your neuroendocrine immune system. These systems don't operate in isolation anymore. The fabulous thing about doing functional medicine work or integrative work or nutritional work is that everything we do for patients is bolstering the foundation for them. There's really no downside. I mean, you look at this list of nutritional recommendations for someone with autoimmune disease, you know, there's no downside to any of these things. You also need to remember that the way I view ALCAT is, okay, let's look at the gut. Let's get the inflammation out of the gut. How do we do that? Well, we have to heal the gut lining. We have to reduce inflammation, which means we reduce inflammation on what comes in the mouth. So that's how the ALCAT test can help you eliminate what's coming in that's going to inflame the body. And then you can look at stool analyses to see how they're digesting, see what mix of bacteria are in the gut, see if there's parasites or pathogens or yeast growing in the gut. So begin to layer in putting the whole package together. The other thing that I like about the ALCAT test earlier on with patients is, you know, you can only help them with so many things at once. And I found that a layered approach is very effective. So maybe start with some hormone therapy that you can help them with because you're the prescriber. But the ALCAT test is something they can do on their own. They can take that test and implement it immediately and begin to learn what inflammatory foods feel like in their body. For Libby as well, we used hyperbaric oxygen and home oxygen therapy, and actually I'm probably going to bring an oxygen, a hyperbaric chamber into the house for her, and heavy metals, which her heavy metals were not a problem. You know, who do you repeat ALCAT test on? ALCAT test is expensive, and if people are paying out of pocket for it, you know, it can seem like a big barrier. I'm looking at return on investment. You know, what's the cost of autoimmune disease? What's the cost of resistant and persistent weight? What's the cost of fatigue? What's the cost of chronic fatigue syndrome? You know, I had a lady who, after implementing the ALCAT test results, her fibromyalgia, quote, washed away. That was the term she said. She said, in about 3 days after I got those foods out, my fibro washed away. That's a game changer for people. So I don't tend to retest a lot of people. I'll tell you who I do test. If they come in, many people that I see here in Michigan have been through other docs kind of tinkering around with integrative medicine, but really don't put the whole package together, and they'll come in with multiple labs and IgG panels, and they really haven't gotten anywhere with that stuff. And that's somebody that I will recommend an ALCAT to. And they tend to make progress with the ALCAT, and they weren't able to with IgG testing, which is, you know, sort of anecdotal, and maybe there's docs out there that have other experiences. But I do find that it's so practical and brings a lot to the table. So autoimmune, inflammation, an elimination diet is extremely challenging for people. And it's hard for patients to accurately identify foods they're sensitive to. So those are many of the patients that I retest. Some people might say, you know, I'm showing up with foods that are on my green list. You know, I'm having symptoms with foods that are on my green list. If they can't navigate that well, we might go back and do a 150 food panel and just take another snapshot and see where they're at. And again, don't forget about hormones, thyroid, nutrients, and the gut biome. This was her test, Libby's test, about a year after the first one. You can see she's cut her yellow list significantly. The foods did change. Some of them remain the same, but actually at this point she was able to add in many foods that she had not eaten for a year, like chicken. Consequently, though, she did notice that after several weeks of adding in those foods that had previously been on her inflammatory list, she started having symptoms again, so we removed those. And again, this is a thinking man's test. This is for your patients to begin to learn what foods, what it feels like to have foods inflame their body, and how to begin to identify that and remove those. A question came up. What do you do? Okay, we'll look at my wife's test. This is so she did not demonstrate a gluten sensitivity. Gluten is, you know, there's a lot of gluten talk out there. Some other labs are developing specific tests for celiac disease. The general medical literature seems to have, you know, picked up on this, and so it's getting more attention. Gluten seems to be highly inflammatory. When I talk to docs in my world, you know, in the fellowship and in the master's program that have been doing work, especially the pediatricians, they really stress how inflammatory gluten is to the gut and how much it impacts children's behavior. A general rule of thumb, if I'm prepping someone for an ALCAT, but maybe I don't feel like they quite have the buy-in, I'll tell them, look, eliminate gluten, soy, corn, yeast, and milk products. Do that for 3 or 4 or 5 weeks and see how you feel after you do that. And, you know, I haven't had anybody come back and say it didn't make any difference to me. Most people lose a pound or 2. Most people have improvements in energy. Most people have less bloating. Then I say to them, okay, now the ALCAT is going to look at 320 different foods and chemicals that you probably eat every day or certainly every few days, and will allow you to figure out which ones are causing similar symptoms. And they go, oh, I get it. And many times that's their trigger for going ahead and doing the test. Gluten is so inflammatory. As a general rule, I have a low threshold for recommending a gluten-free diet. And also remember that gluten is found in many things. Long-lasting lipstick, gummy bears have gluten. So, you know, use caution or people are going to have to really go dig for gluten. Here's another common sense. Let's go back to common sense. If you're eating out of a box, that's probably not normal food. Now, it may be normal food for an American, but it's really not real food. So what I teach my patients is, if you find yourself reading a label, searching for a food that's on your ALCAT list, you may want to consider not even eating that because it's been processed. Otherwise, you wouldn't be reading the label. So many times I try to help them reflect on, okay, let's be practical here. Maybe we should consider eating the way that people ate 100 years ago. Ice cream also has lots of gluten. Thank you, Dr. Blum, for your feedback on that. So candidates for ALCAT testing. Well, my general rule of thumb is everybody needs to deal with their gut health. Gut health benefits every system of the body. And so everyone is a candidate for an ALCAT test. Doesn't mean everybody has to go do the 320 panel, but as part of the wellness package, I think everybody should be at least educated on it. Certainly people suffering from peculiar clinical systems, athletes looking to improve performance, peak performers. I have executives and lawyers and business owners in my practice, and these people notice it when, just as you would as a clinician, when your memory slips a little bit, when your attention slips a little bit. How do you get that extra edge? You've got to remove the inflammation. How do you remove the inflammation? Well, you can pump yourself full of antioxidants, which is good, or you can reduce inflammatory load, which the best way to reduce your inflammatory load is to start controlling what goes in your body. As I sit here and sip a latte. Anyway, I use ALCAT as part of the comprehensive wellness program. I really push it toward people who have specific gut diagnoses and issues, autoimmunity, and kids. And then the things that make you go, if I'm sitting there, looking at a patient and I'm feeling glazed over, they probably need an ALCAT test because they've got something going on with the immune system. And so the question that I get many times is, well, I don't really understand what this test is for. And my general, I like to give people the 40,000-foot view. Look, this is a functional assessment of your immune system. This is going to let us determine what foods are inflaming your immune system. Inflammation is disease. Inflammation causes, physiologic stress in the body, and long-term chronic physiologic stress in the body will ultimately lead to hormone imbalance. And so I begin to help put help them connect the dots on why this test is meaningful. Every client of mine is informed about the ALCAT test because I also like to paint the picture of the things we may do down the line. I don't recommend that everybody get the test. If I have someone who is talking about their love of ice cream and other things that they do related to food, we got to get them a little bit further down the path of dealing with some of those food issues psychologically than they currently are right now. So handing someone who's a food addict a food sensitivity test that shows they have to eliminate 30 or 40% of what they eat is probably going to be a zero-sum game. So create the win-win, bring the value, work with the patient, meet them at their level. Let's see here. Okay. Oftentimes I find the doctors I consult with on how to begin to bring integrative aspect or functional medicine testing into the practice have a hard time knowing how to package these tests as far as patient perception of value. Number one, you're the expert, and patients want and respect your opinion and your guidance. So do the ALCAT on yourself, do it with some family members, develop a sense of how you can use it, and then you can offer it to them confidently. and understand that this is a potentially game-changing test for certain people. And the other nice thing about it is this is patient-directed. I have this test go directly to my patient. They don't need the expertise of Dr. Jamie Wright or to pay him the hourly rate in order to take action. And so it puts a lot of power in their hands. And ultimately just let the patient determine the test. At least that's my philosophy. If they're going to spend hundreds of dollars on a test, I want them to feel like they made that decision and not that Dr. Wright did. So here's what I do. If I order the test, which I order the ALCAT test on about half of my patients, I have the result. ALCAT sends the result packet directly to my patients. I tell them, you call me and make an appointment in about 3 to 4 weeks from when you receive that test, because I want you to spend 3 or 4 weeks reading it, read this thing every day, read the book, think about it, think about how foods are affecting your body. I want them to have some of that brain time with the test results because they're going to generate a lot of thoughts. They're going to come in with some aha moments. And I don't want to go through, I don't want to spend my time sitting there going, yes, pork, yes, that means, yes, pork is on your severe, that means you shouldn't eat pork. They don't need me to tell them that. They need me to motivate them, show them the big picture, and paint what the future is going to look like over the next 2 or 3 months as they begin to implement this. During the face-to-face test, or sorry, during the face-to-face meeting, I say, what do you think of these results? What have you done so far? What's your plan? I want them to come to me with answers because that's going to help me measure how motivated these people are and how hard I can push them down this path toward getting their gut cleaned up. And the other thing I really focus on in general with my patients is let's focus on learning here. The ALCAT is great because it's a learning process. And so it doesn't have to be rigid. You don't have to wipe everything off of your plate, the first week. In fact, that's not likely. It's probably not going to happen. And I tend to say to people, look, this is going to take you 2 or 3 months to really get a handle on this. So work with it, take your time, and it's about long-term wellness. It's not about checking boxes off our to-do list here. So I like them to read the results daily because that kind of repetition gets those foods into their subconscious, so when they're sitting in the restaurant, they're going to intuitively know to stay away from certain foods. By the way, it's nearly impossible to eat healthy at a restaurant unless you simply order off the menu. What I began to do is I just say, hey, this is what I want, and I ask them to make specific food for me in a specific way, and almost every restaurant will do that. If they have a large number of sensitivities, I do the 80-20 rule. Let's knock out let's knock out the moderate and severe categories in the blues. Just do those, stay away from them 100%, then look at that yellow list. Pick the things on that yellow list, pick 5 things that you eat every day and get those out of your life. And just do that for 2 or 3 or 4 weeks, see how you feel, and then go from there. I don't like them to jump on the phone with ALCAT right away. I like them to get with the ALCAT. The ALCAT offers a complimentary evaluation and consultation. I like them to be well educated before they burn ALCAT's time and they burn that free consult. So that's how I coach them. And then I think it's reasonable to see these people every 4 to 8 weeks, depending on how much they want you and need you, just to keep them going. One thing I've picked up on with these inflammatory foods is many times they have a tell. The poker players have their tell. Well, for instance, go back to the case of my wife with Libby. Her bladder pain is her tell. Okay, it's the sign that her body is being inflamed. And so they can pick up on these pain or itching or arthritis symptoms and use that information to teach them. Let's see here. All right. How do you increase your revenue with a test? Well, you bring value to people. That's how we increase revenues and everything. So bring value to them. go there with them. These people are challenging. They need your help. They want your support. You're going to gain referrals from that. You're going to enhance your reputation. From a billing standpoint, you may want to take a timed billing perspective on this. It's easy to burn 40 minutes discussing an ALCAT test with people. That's a 99215. You need to document 40 minutes face-to-face time and counseling. You can bundle this test into a weight management program. I've bundled it into an executive wellness program where I take some of the CEOs that I have, and they get a panel of tests that I find most effective to help people with their physiology, and that would be hormone testing, nutrient testing, and food sensitivity testing. ALCAT also has some nutritional services that, like menu services that you can sell to patients and make a little bit of a profit on. But again, the focus is we want to bring greater value to a greater number of patients, and the financial benefits fall behind. Do use caution with insurance billing, but we're not going to get into that right now. But if you have questions about that, we can consult with you on a one-to-one basis regarding that. As far as panel selection, tailor this to your patient's need. If I've got a disaster patient in front of me, then I'm going to use the most comprehensive test I have, because you know what, it's worth it. I don't. The downside to doing to quote getting cheap and doing the lower level testing is, if you don't get the full value, the full response that you want, then you're wondering, okay, well, are these adaptogenic herbs that I put you on, are they causing you inflammation? So if I'm dealing with adrenal fatigue and autoimmune issues, I want to see that herb panel, because if ashwagandha causes severe inflammation, I'm not going to put them on that as an adaptogen. I'll tell you too, if you don't get food, sensitivity testing on patients with gut problems and you're treating their adrenals, I've tended to stay away from herbs in general, because when you start doing these herb panels on people, you're going to find many of them have sensitivities to things like resveratrol and ashwagandha, common things we put in our supplements that are treating adrenal fatigue. Now, for obesity, basically obesity is inflammation. So if you really want to help your obese patients long-term gain permanent weight loss, that doesn't make any sense, get permanent weight loss, treat their inflammation. So get them on the antioxidants, get them on the alpha-lipoic acid, get their gut cleaned out, deal with the dysbiosis, get them their food sensitivity panel, and let them go for it. Pump them full of vitamin D and good nutrients, and they're going to do well. All right, I've talked enough. Let's get to some questions here. There was I know Dr. Blum is out there. Dr. Blum, why don't you address, because you guys sent me a lot of different questions here, why don't you answer that one particular question while I review the others. Can you come on and do that?
Sure.
All right, Greg, take it away.
Hi, I'm Dr. Blum. I work at ALCAT. The question was, can foods migrate from the acceptable or the green foods into the more reactive columns? And the answer is yes. And there's two reasons for that, or at least two reasons. One is overexposure to a food that was acceptable may turn it into a reactive food. And the other aspect of this is the situation with the leaky gut. Because the gut is unstable and the walls of the small intestines are inflamed, there tends to be migration of different foods across that barrier of what's going to be reactive and what's not. For that reason, we started strongly recommending the leaky gut protocol and an oral detox along with the ALCAT elimination program, because it seems to make a big difference in preventing the acceptable foods migrating into the red column.
Yeah, you know, stay on, Dr. Blum, because we could we'll maybe talk here a little bit. Here's when you begin to study how the body prepares for digestion and the gut biome and all these metabolic processes that go on in the gut that the gut flora are doing for us, and inflammation of the gut lining, and 80% of the immune system is located in and around the gut. And you think about the way we eat. I mean, we can be exposed in the industrialized world to the same foods every single day. And maybe I'm getting a little esoteric here, but when you look at animals in nature, what do? They migrate through different areas, and with the seasons they migrate into different regions. So about every 3 or 4 months, they're changing a bulk of the foods they're being exposed to. Now, I don't have any clinical research to back this up. This is just an idea and thoughtfulness, but it's interesting that the white blood cell lives about, 120 days, right? And that's about a quarter. And animals would tend to migrate about every quarter to a different food area. I'm beginning to encourage my family and my patients more and more to go back to the way people ate, pre-industrial revolution. Not completely, but increase the variety of foods, get back to whole raw foods, minimizing cooking so you're not disturbing the nutrient value of the foods, and I think that's probably going to bring a lot of value to people long term. Let's see. Here's another question.
See, there's another question, Dr. Wright. I think we can answer this one here. Why is red wine not in the 200 food panel, and how do you counsel your patients on the red wine intake if there's no sensitivity to red wine?
We counsel our patients to look at a couple things. We test, right, what do we test for? We test for what wine is made from, which is grapes, the yeast that is used in the fermentation process. And from that, we get a handle on whether we can recommend wines, whether they're white, rosé, or red. And so we look at the brewer's yeast and the grapes. Now, the question goes further because a lot of patients want to know what kind of alcohol they can drink. And so the question is basically the same. What is the alcohol made from, and how do you do with yeast, for fermentation? So you can look at all kinds of things, sake and other liqueurs, and obviously malt is used in beer. We test for hops, malt, and yeast, and barley. So you can take a look at that. And obviously some beers have wheat and rice in them, so you'd have to look at those constituents as well. And so we ask people to take a look at what they're drinking and what it's made from. And that question also goes to vinegar. Some people want to know if they can have vinegar in their salads or make a dressing. And it's what is the vinegar made from, and the same aspect is looked at with vinegars as well as wine and alcoholic beverages.
Here's another question. Not on that. I'm intrigued by this question about the applicability of ALCAT in the treatment of cancer. I'm going to tell you what I know on that, and then Dr. Blum, feel free to correct me if I'm wrong. I don't believe there's any studies on that, and I wouldn't use ALCAT to treat cancer per se. I would use ALCAT as a modality to reduce the inflammatory burden in a cancer patient's treatment regimen. So aside from supporting them from an antioxidant standpoint, anti-inflammatory standpoint, gut health, those healing foods, the cancer-fighting foods, cruciferous vegetables, hormone balancing if it's appropriate. I think that using the ALCAT test in that setting would bring value to patients. And I have one patient in particular who had advanced leukemia that we did hormone therapy on, a man, as well as ALCAT testing. Can't really say, I don't know if how great a value it brought to him, because we're in the early stages, but I think it's meaningful in that way.
Okay. Okay. Which one? Let's see. The red wine we addressed.
How about rationale for the strict rotation of foods?
Okay. I believe the full question is, where is it? Is there any evidence-based rationale to recommend the strict rotation of foods?
Dr. Blum, what are your thoughts on that?
Well, there absolutely is some published literature about rotation of diets. It's not as current as we would like, and it's not as strict as I would like to see it. So it's kind of one of those aspects that we like because we've seen good clinical outcomes with it. Whether we have the data to stand up to peer review is kind of a good question. There is certainly some data out there, and a lot of the older work done in nutrition is based on rotation. So that's sort of my answer about that. I wish we had better published work, but we don't. Jamie?
What I'd like to say to those clinicians out there who are doing functional medicine, I'm just going to call it functional medicine. You can call it a lot of different things. What you're doing is you're recognizing that there are aspects of what we do that can help people for which there is no evidence right now. So you're really putting yourself out there on the forefront. You're saying, you know what, I'm going to think, how can I help this patient? And you're going to think from a physiologic standpoint. And it's not like we're doing surgeries on people that they don't need, which, that's maybe what, many doctors do or used to do. So it's okay to try to bring value to people and help them if you're first doing no harm. I think that the evidence for these concepts is going to pile up and is piling up as we speak. Being a part of the master's program in metabolic and nutritional medicine, I see a lot of the core literature and research that's going on in this general field of nutrition and inflammation and gut, the gut biome and autoimmunity. And, the number one goal is really help your patient. First, do no harm, and then bring value to your patient. So I just want to encourage you that if you're bringing value to the patient clinically, that's meaningful.
Okay. Let's see. Here's a good question. Does the patient need to be actively ingesting the food to be positive? What if the patient has stopped gluten? Will the test be valid?
I'll tell you my 2 cents on that. What I've found is many people who have had positive gluten testing in the past with IgG or IgA, or they got better when they got off gluten, and they stay off it because they feel so much better. And they'll have an ALCAT test done, and they'll say, well, why doesn't this show gluten? And there's a couple reasons. Number one, they haven't been exposed to it in years. That may be. Number two, they may have had a false positive. And I don't necessarily, in the past, I don't necessarily encourage them to go back on gluten just because it's not on their ALCAT test. Dr. Blum, what do you think?
Well, a couple things. First of all, the ALCAT is not exposure dependent. So if you look at the test in its entirety, you don't have to have been exposed recently to each of the 200 foods for there to be positives. Oftentimes I get questions, I have never eaten bok choy, and bok choy is in my moderates. How could that possibly be? Well, the explanation is multifactorial, but certainly exposure is eliminated. But what's not eliminated is cross-reactivity and genetic predisposition to having a given food be problematic. If you look at evolution, convergent and divergent evolution, different proteins in different foods arise for different reasons in very different food types. And we have to look at that piece as to why different foods may be very reactive in some people. As far as gluten and gliadin go, it is a difficult ingredient or difficult protein to have always show up positively because it's local. In other words, it's active at the site of the villi. And because of that, it's not always easily found to be positive in our testing. We're actually working on that in our R&D labs at this very time frame because we're trying to increase the sensitivity of the gluten and gliadin. And hope in the next few months we have a better mousetrap, if you will. Mm-hmm. There's a lot of discrepancy in the sort of the functional medicine literature about what should be the true rate of gluten sensitivity. If you go to the IFM or the Institute of Functional Medicine seminars, they're quoting rates between 60 and 80%. And Alessio Fasano of the University of Maryland, who's one of the gluten gurus, just published an article that just came out today talking about the differences between gluten sensitivity and celiac disease. And his rates are less than the 50 to 60 to 70% that the IFM talks about. So I'm not really sure what the true rate of gluten sensitivity is. I do know from talking to many clinicians, when they take their patients off gluten, a large percentage of them get relief.
Okay, we have time for about one more question. There's a question, can you talk about how inflammation may affect or cause ADD?
Oh, yeah. I've got a 5-hour lecture on that, so why don't we just transition? Let me pull those slides up. I'm no ADHD, autism expert. I got interested in autism and ADHD when I researched hyperbaric oxygen therapy, and I wrote a paper on hyperbaric oxygen therapy and its treatment in brain disorders. There's a huge amount of literature in the autism ADHD spectrum world on this concept of brain inflammation. And I'll just give you my my 2 cents here. This will get you started, whoever's interested. But again, remember, I am not the guru expert. In doing the research that I did, I found this consistent theme between the blood-brain barrier and what those authors were describing as synonymous to the gut-blood barrier. So they were relating this concept of leaky gut, or what's known in the allopathic or traditional medical world as intestinal hyperpermeability, with issues related to the hyperpermeability of the blood-brain barrier. When you there's also functional MRI studies of the brains of people with spectrum disorder showing increased inflammation. There's increased inflammatory markers in the blood of patients with these disorders. So I personally, without the real strong clinical experience from what I've read and working with patients who have children that suffer from these conditions, if I were treating an autism spectrum ADHD child, I would, number one, get the processed foods out. I would look at an ALCAT test and see what's going on. I would look at a stool test comprehensive stool digestive analysis, see what kind of gut biome they have going on. I'd replenish the fatty acids, and antioxidant.
Okay, thank you, Dr. Wright.
My
on the
pleasure.
screen you have the contact information for both Dr. Blum and Dr. Wright. Those of you whose questions we didn't get to, we can address them privately with you. We will make note and email you responses to your questions, but feel free to contact either Dr. Wright or Dr. Blum with any additional questions. Thank you so much for joining us this evening. Please make note of this contact info, and also feel free to contact your rep for any additional questions to get you set up for testing or anything else that you may need. Thank you and have a great evening.